Let's take a look at the lung meridian. Now, when we're looking at the primary meridians on the body, the lung, the large intestine, stomach, spleen, the 12 primary meridians, we want to always keep in our mind the pathway of the meridian. Even though we're choosing specific points along a meridian, knowing the pathway of the meridian is very helpful for a variety of reasons. One being the fact that when pain shows up along the pathway of the meridian, we want to be able to discriminate between which meridian is mostly affected. Because when treating pain, the standard operating procedure is local, distal, and adjacent points. So local points and adjacent points are easy to find, but the distal points are usually based on the meridian. So when we're using, for instance, the jing points, or the points that show up at the corners of the nail, or the end or the beginning of the meridians, depending upon the meridian. The lung meridian ends at the end of the on the thumb at the corner of the nail, then we want to make sure that we're using the lung meridian if we see pathway pain along the particular pathway of the lung meridian. Lung meridian is on the anterior aspect of the arm, large intestine still anterior but more lateral, triple warmer being the lateral aspect, and the small intestine meridian showing up on the posterior aspect. So knowing the general pathway of the meridian as well as the individual point locations will serve you well in a clinical situation. So the pathway of the lung meridian begins here, a lateral aspect on the upper part of the chest. It travels down on the anterior aspect of the arm to the radial side of the tendon of the biceps brachii, along the radial bone, and when it gets down here, we're on the radial side of the radial pulse, and then it comes along through the thenar eminence, along the edge of the metacarpal of the thumb, and ending at the corner of the nail. Now let's take a look at the individual points. Let's take a look first at lung 1. In order to find lung 1, we'll need to find lung 2. We find lung 2, and from there we can locate lung 1. Lung 2 is located in the deltopectoral angle right here. So I'm going to ask you to just press lightly against my hand, and we can see the deltopectoral angle or triangle show up. If you could relax now. So this is lung 2. Lung 1 is just below it. Remember, when needling points on the chest, we need to always be careful of the lungs in terms of our needle depth and our needle angle. The needle angle for lung 1 and lung 2 is going to be away from the lungs towards the shoulder on a transverse oblique angle. Let me demonstrate with lung 1. Right? If you're on a strong angle, you have no trouble and nothing to worry about in terms of bothering the lungs. Okay, let me take that out. And we'll move on. Lung 2 is just above lung 1. Lung 3 is 3 divisions below the axillary fold. So 3 divisions is going to be 3 thumbs breadth, and using Monique's thumbs. Now, Monique's thumb is Monique being much smaller than I am, her thumb is about the same width as one of my fingers, my index finger. So I can use 3 of my index fingers to make this measurement on Monique's body. So 3 divisions below the axillary fold on the anterior aspect of the deltoid, between the deltoid and the humerus, is lung 3. Lung 3 can be needled perpendicular to the skin. 1 inch is no problem. There's not much to hit in there besides muscle and bone. So we don't have any worries here. And lung 3 is actually a good point to treat for excessive grief. Lung 4 is just below lung 3. Lung 3 is 3 divisions down. Lung 4 is 1 more division, 4. Lung 5, a very important point used for congestion in the chest, productive cough. It's on the radial side of the biceps brachii tendon and is needled again perpendicular to the skin. There are 12 divisions between the wrist crease and the cubital crease of the elbow. So halfway is 6 divisions, and 1 more division up, 7 divisions along the lung meridian. So the lung meridian travels from lung 9 to lung 5. If we draw this line and we come 5 divisions down from lung 5 or 7 divisions up from lung 9, we come to lung 6. And lung 7 is closer to the wrist. So it's lung 5, lung 6, lung 7, 8, and 9. 7, 8, and 9 are right in a row down here. Lung 9 is located at the wrist crease on the radial side of the radial pulse. Lung 8 is 1 sun proximal to the wrist crease on the radial side of the radial pulse. And lung 7 is actually off the line. So this line from lung 9 to lung 5 is the lung meridian. However, lung 7 jumps off the line. In fact, the name of lung 7 is translated into English is actually broken line, right? Li Chi is the name of the point. So it's lung 9, lung 8, lung 7, and then back to the line to lung 6, and then lung 5. So lung 7 is located, let's just turn your arm a little bit here so we can get a better shot at lung 7. Lung 7 is located just proximal to the styloid process of the radial bone. And we can feel in here a little bit of a cleft in the bone, that styloid process. We can see that there's a small blood vessel there. The thing about an acupuncture needle is that between the pressure of the insertion tube and the round point on the needle, we tend to push blood vessels out of the way. So we don't really need to worry about that little blood vessel, but be careful that you don't puncture a blood vessel. Tap that needle in and get a little stimulus there. Lung 9 is located at the wrist crease on the radial side of the radial pulse. So you perhaps noticed I should have pointed out that I felt for the pulse first and then put the needle in. Right. Lung 10 is in the middle of the metacarpal of the thumb on the thenar eminence at what we call the junction of the red and the white skin, where the palmar surface of the hand starts to turn into the dorsal surface, to the back surface of the hand. And lung 11 is found at the corner of the nail. So let me remove this needle to keep it comfortable for our model as she moves. Let's slide your hand up a little bit like this. And here is lung 11. Lung 11 can be treated either with a needle, or it can also be treated with bleeding therapy. Okay, let's move on to our next meridian.